It's the same as every year. You'll be split into 3 groups: patient, relative and colleague. You've got a lot more time this year. You go through it this morning, there's a lot of background information. I've got the competency matrix, which I'll give you all a copy for your groups. You know, the empathy, communications, conceptual thinking and professional integrity. Now, welcome back. This year, you see, we're Star Wars. We've upgraded from the Simpsons. So, Ayaz is a role player and one of our QAs. This year we're only having 2 QAs, which would be myself and Ayaz. I don't know what I am, probably CV to, I'm the little one. Right, well, you know what a simulated patient is: a non-medical person who takes on the role of the patient in a consultation scenario in an OSCE exam. Someone who, with guidance, notes and training for the exam team, pretends, or doesn't pretend, you become the patient, described in the scenario. Someone who consistently takes the same patient role for the day, a number of times a day. I know it's quite tedious, but you need to keep to that same standard all the way through. Someone who is able to respond appropriately and naturally to the doctors. They'll all have differing styles, and question and interacting with you as a patient. What is expected of you? Reliability. The fact that you're, said you can come on that day. Good timekeeping. And if we need you at a certain time, you need to be there by that time. Lateness cannot be taken into account. Courtesy, politeness to candidates and to assessors. A willingness to ask when something isn't unclear. Confidentiality, you all sign this paper. Using the briefing information to answer the candidates' differing questions, but often using your own words to express things naturally. You have got a certain number of must-say words or sentences, and they must be verbatim. Covering the patient's emotions as well as factual information, and again, the key statements. What we expect of the exam team: courtesy and respect, training how to take on the role of the patient, willingness to answer questions you have about the patient's scenarios you are given. So please ask any questions you feel will help you play that patient. Good timekeeping, that is a must. Payment and lunch on every full working day. The payment will be at the end of the 11 days or the time when you finish. Hopefully we find it enjoyable and working atmosphere and a sense of teamwork, and we do have some fun as well. Right, best practice assessment principles. We select the right person for the role. It's fair, explored in it has been explored in pilot and candidates' reactions. Reliable, inter-rater, I can't read, I'm very sideways. Reliability, making criteria is the same. Standardised, assessors' awareness of standard marks, performance of simulators. Valid, its opportunity for competencies. There is no outcome to all of the scenarios. It's nothing that you can say, well, yes, doctor, I'll do that. There is no outcome at the end. You all finish on the same. Thank you, doctor. It's something you've given me to think about. Again, this is the competency matrix, which I've kept separately to show it. It tells you there, case A, which is the patient, is empathy, sensitivity, communication skills, conceptual thinking and problem solving. The case B, which is the relative, empathy and sensitivity, conceptual thinking and professional integrity. The same for case C, empathy, communication and professional integrity. You don't get involved in the written case, that is done separately. Right, demeanour and use of emotion. You have to stay in role, alarm or end of interaction, be as consistent as possible with respect to overall demeanour and the type of emotion and its degree. You will work that out today on the level of emotion. Standardise these factors between you all. Individual simulators must keep them consistent and constant throughout the simulation. Minor emotional fluctuations only. At the beginning of these scenarios, it tells you what they're looking for, anxiety, you know, it's got it written on each scenario. If you're not seeking to mirror the emotion of the candidate, as in sometimes the intention with simulation exercise, it's what you've got on your written script. Unless it's in the script, do you not use particularly inflammatory words that might trigger a procedural response from the candidate, e.g. harassment, negligence. We are not assessing their knowledge of existing policy process. Right, used scripted and unscripted dialogue. You must say all the must-say lines verbatim at some point. Seek to use all the lines provided in response to the relative prompts of the candidate. These prompts do not have to be exact. You should use your lines wherever there is a reasonable opportunity. You may omit lines where there is no reasonable prompt from the candidate, where it would be clearly forced. As far as possible, try to give lines verbatim. It's fine to repeat a line once, twice, so 3 times in total is acceptable. You must not say a line 4 times. Use background additional information. You may introduce extra info between your lines where appropriate, normally in response from the candidate. There is an awful lot of background information, at least 2 pages on all of them. So this year we've got even more than last year. Right, additional, just try not to lead the candidate, don't hand it to them on the plate. Be concise, do not ramble, as I am doing. Be aware of the talking time ratio. Candidates must have plenty of time to speak, ask questions, respond to your lines. Each candidate must have the opportunity to demonstrate the indicators. There is intentionally no clear resolution in the scenarios. A good character may make your character feel slightly better or better informed, but there is no definite change in your emotion and no neat answer to your concerns. It is a process, not outcome. Don't let on how well the candidate is doing, especially when using unscripted dialogue by saying, "Oh, I feel so much better," or "I feel worse." Grouped bullet points should be delivered separately rather than in one diatribe. So if you look at it, it will have sort of like 3 or 4 things there, but they need to go in separately. Points to consider about competency. All the exercise tests empathy and sensitivity. Candidates are primarily assessed on their response to the demonstration of the subject's emotion, whether verbal or non-verbal, and on exploring the subject's perspective of the problem. Where conceptual thinking and problem solving is being assessed, please do not assist the candidates by suggesting solutions or different perspectives. Please leave the candidate to think about this, e.g. by responding, "I'm not sure, what do you think?" Please do not accept a simple solution to a problem. Try to rebut it to give the candidate more opportunities in its competency. Where professional integrity is being tested, the candidate will be faced with a dilemma between 2 different principles. Please do not give any views on these unless it's in the script. If the candidate only considers one integrity issue, you can remind them of the dilemma. Case types, as I've said, there's 2 patient ones, 2 relative or carers, 2 colleagues. Examiners mark on empathy, sensitivity, communication skills, conceptual thinking and problem solving, and also professional integrity. So please allow space for candidates to talk and show skills. Simulation. Consultation with the patient is 10 minutes.
Oh,
No, we haven't got that one. No. Fairness is really important. Consistency throughout the day, especially emotions. Take feedback as formative comments rather than being defensive. Please do not be late, because that throws the whole day out. Don't miss cue. And don't carry info to subsequent candidates. After each one, control delete everything. Don't discuss candidates in the corridors or roles in the corridors. It's a very tight, as you know, doing it last year, it's very tight, and sound does, travel. oh, it's 2015, but it's roughly the same. Emphasises again, consistent demeanour and emotion, stay and roll throughout, must say lines needed to be verbatim, seek to use all lines in response to relative prompts, best approximation to verbatim. Can omit non-essential lines if no reasonable prompt. If cues are missed, in general, can prompt again. You know, no more than 3. Right, morning calibration. At recruitment, there's normally a morning group exercise, as you all know. We get in earlier, go into your little groups, go through the whole case. On the first day, if anything's come up, you discuss it in the morning at the calibration. If anything comes up during the morning, you discuss it in the afternoon calibration. This is sort of like to help all role players at the same emotional level on cues. Some of you will be in that day, but not be in the next day, so you need to go over what had happened in the day before you've come in again. Because until we've had all the people in for simulation, you know, check in, we don't know who's doing what at the moment. Thank you. Any questions? We will try to do some comic thing, but as you know, it's very difficult in that corridor, especially on this first floor. You've got 11 rooms, one end.